Well, good afternoon, and again, my name is Jeanne Blankenship. I'm a registered dietitian with the Academy of Nutrition and Dietetics. You may remember us as the American Dietetic Association. We went through a name change a number of years ago. And I'm really proud to be up here and represent the Academy, but I also feel like I'm representing many other organizations in the room when I talk about the work that we're doing. Because I think what we've learned over time is that it really does take a collaborative effort, and what we can do as an organization is really limited compared to what we can do when we partner with others. So I'll be calling out people in the room as I talk through my slides today. We are an organization that represents over 100,000 credentialed registered dietitian, nutritionists, and other nutrition professionals in the U.S. So we like to think that we bring the voice of the dietitian, nutritionist forward in many conversations. We're fortunate that we have a weight management dietetic practice group, and that is one of our largest practice groups. They carry a very significant voice. And this year, it's chaired by Eileen Ford out of Philadelphia. And also important in that role is one of our colleagues, Dr. Nina Crowley from South Carolina, who really works with me a lot on the policy side. So the voice of that group is really important in the conversations that we have. And they're interested in the topic today. It's great to see so many dietitian, nutritionists working in the different military services and to see them advancing their careers at such high levels. I was just so pleased to see the conversation that they brought today about the importance of food and nutrition in relationship to physical activity when it comes to energy balance. So I'm inspired by the work. I think we've heard a lot of different presentations today. I know that from my perspective of attending past workshops, this has been very informative. My mind is swimming with a lot of different new ideas. So as I thought about what I would share with you today, there's two spaces where we really get involved in this addressing overweight and obesity. So the first side is looking at what can we do to help really prevent and then treat obesity. So from a clinical standpoint or a clinician standpoint, also looking at community-based programs and services and the advocacy work that we do. But then also, what as an organization can we do to make sure that the registered dietitian, nutritionist, and other nutrition professionals are coming out into the workforce ready to address this chronic disease. So that's how I'll focus the conversation today. So in terms of food security programs, I think it was mentioned earlier, we know from the GAO report that we definitely have a link between receiving SNAP benefits and the military, and I believe it's about 1.7% of active duty military recipients in the SNAP program. The more junior that those folks are, if they're a E6 and below, they're more likely to be on these programs, and then also with the number of children that they might have would also impact their eligibility. During the current Farm Bill conversations that we're having, which is where SNAP and SNAP education and obesity prevention education programs are addressed, what we know is that there's some disconnect between how other programs like the Women, Infants, and Children and others, school food nutrition programs, how they look at the basic allowance for housing and calculate levels of income. So that's something that's on the horizon for us, and as we have these conversations, we want to make sure that when we're addressing food insecurity that we're looking at those criteria for eligibility similarly across programs. In terms of SNAP education, I'm thrilled to have someone following me that will be talking about the expanded food and nutrition education program and SNAP education. Those are also important programs, lesser known in the Farm Bill, but that's a space where many of our members work and actively work to educate consumers about the importance of food and nutrition, and to really be that link between what we say in the dietary guidelines or the food that we provide through the SNAP program and helping them to translate that into everyday living and to do some of what these other programs that have been outlined today have suggested. In terms of the WIC program, we don't have a lot of data showing the relative rates of military participation. We know that we've got programs that operate in many of the overseas locations, but really ferreting that down into saying how many people do we have on the program. we're not exactly sure, but what we do know is that the eligibility for WIC is actually higher than it is for, or more inclusive than what it would be for the SNAP program. So there's less income eligibility or restrictions on WIC than there are on SNAP. But what you see in some of the outcomes of the WIC program are just the importance of that nutrition education and intervention as we think about those who are in the military and the children that we want to bring up that are more likely to be recruited and retained. That WIC nutrition education piece has been shown to be very important. The WIC program is also, as Heidi mentioned, really important in terms of the education about breastfeeding, both initiation and continuation, so addressing the duration as a key component to health. And as we talk about the dietary guidelines and the upcoming inclusion of the 0 to 2 age group, that's been an initiative that our organization has been very much involved in and wanting to help champion, because that early intervention in life plays such a critical role. In terms of school nutrition, we also see food insecurity there, so efforts to increase food security by offering meals, and not just what you might think of in terms of the standard school lunch. We're talking about breakfast in the classroom, we're talking about lunch, we're talking about after-school programs, oftentimes programs that are associated even with athletics, so that those kids that are on school campuses for 12 and 14 hours a day have access to food. And even those after-school programs are important because they allow parents in the afternoon to remain at work and not to worry about those children that are in after-school programs. Oftentimes they're able to come home already having been served dinner, which in many of our schools in the nation can be an important piece of the total daily intake. But what we know is that on the Department of Defense schools, that about 24% of the students are eligible for free meals. So again, that's showing you that 1 in 4 students meets those income criteria to be eligible for the program. Anything we can do like this is important in terms of maximizing the food dollar. You heard on some of the previous presentations about how people who are in stressful situations with overweight and obesity are forced to consider alternative options, perhaps some types of gimmicks, supplements. And so here we have also a group that's food insecure, and yet they're trying to do these things over on the other side to manage their overweight and obesity. So we like to hope that misinformation and that we can talk about this from a collective approach when we address our military troops. In terms of access to care, we've been involved with groups in this room on the standards of care and obesity competencies. Bill's great work in this area have really started to look at what can we all do to make sure we're coming at this from the same or similar perspective, and that we all kind of know what we need to do within our lanes to work collaboratively. The Alliance for a Healthier Generation, we've been a proud partner with them for many years, and recent white paper came out that showed that it really is important for the physician to make that commitment and to make those referrals and to have a system and infrastructure ready that will allow for, the appropriate number of visits with the providers, but also a reimbursement mechanism. I give a shout out to TROA, the Treat and Reduce Obesity Act. How that applies to you all, I think, is that as we have worked on this with the Obesity Care and Advocacy Network, is we've started to realize the link between that work and the work of mission readiness, the work of the military programs, and to try to think about what we can do as a coalition to advocate for you and the services that you provide or that you need. So how can we on the outside help to strengthen these programs? It's been great to hear about all of these today, but I have a feeling we're not really reaching the number of people that we need to really make a dent, that there's probably a lot of people that would meet the BMI cutoff for acceptance into the program, but we might not have that reach yet. So what can we do to help you achieve that? We also know that the Treat and Reduce Obesity Act, which would improve access by allowing services outside of primary care, so meeting the patient where they are, and also allow additional providers like psychologists and registered dietitian nutritionists to bill for that, we would see those types of services then mirrored in the Medicare for Life program. And I think that's important as we think about that 80% that come out of the military with overweight or living with obesity. Obesity Care and Advocacy Network, we have started to address this topic of military readiness and retention and had an initial meeting about it. I'm sure after today we're going to go back and look at, again, what can we do to support you all in the work that you're doing. I mentioned weight bias and stigma. There is no shortage of that even within my own profession, and we have recognized that we need to take the bull by the horns and to look at what we can do with the Obesity Action Coalition, to work with OCAN, the Stop Obesity Alliance. Like, what can we do to bring these folks together and have a conversation with our own professionals and encourage them to address those issues that are barriers to providing quality care? And a few other things. I know I'm out of time, but what I wanted to mention was in terms of workforce readiness, one of the big changes that we brought forward about 2 years ago now was the certification specialty in obesity and weight management. That's a certification that's interdisciplinary. It has been successfully obtained by about 270 folks so far. There's been 3 exams. It's open to exercise physiologists, psychologists, as well as dietitians and other disciplines like social workers. So I think that's a positive step that we can start to look at. How do we get people positioned on interdisciplinary teams that have some specialty in this area of obesity and weight management? We just updated our certificate of training in obesity interventions for adults. There's a pilot program going on right now. That's been in existence for a number of years, but we're trying to update that and bring it up with the most current science. We offer a similar program on the pediatric and adolescent side as well. And then finally, we're planning to have a session similar to what we're talking about today, but maybe focus more towards registered dietitian nutritionists and look at what can we do as an organization and as a profession to help not only with overweight and obesity, but do that in the armed forces and assist with the work that you're doing. Our session also, I think, one thing we didn't have here today was the voice of military personnel who live with obesity and who face being discharged and separation. I think that voice is very important to hear from their perspective, whether they feel like they have access to all of these great programs and services and what they see as the barriers might be to achieving care and moving forward. So thank you, and I will pass the baton now.